If you are an expectant mom, or maybe you know one, you're going to want to come on over to the television and check this out closely. One Valley Hospital is offering a new way to ease the pain during delivery. Heidi reporting from Tempe.
All right, ladies, I know what you're thinking. If you've ever had a baby, you know the pain that goes along with that. And then you hear laughing gas, and you're thinking there's no way that's going to be enough to dull the pain of labor. But the doctors out here at Tempe St. Luke's say it is. I want to bring in Dr. Marchand. He's an OBGYN. Let's talk first about what we typically think of when we think of pain relief during labor, and that's an epidural.
Right. So epidural is classically one of the traditional methods of analgesia that's offered during labor and delivery. As you can see, this is an epidural needle here. If I can show you on my lovely patient Kristen, this is usually placed in the lower back, and it gives you a lot of pain control. Now, this is going to have some undesirable side effects as well, because she's going to be numb pretty much from the waist down after she gets the needle. And of course, it's not going to stop the minute she delivers. It's going to continue for a few hours after the baby's actually out.
All right, so you guys are introducing, you're only the second hospital in the Valley to introduce the nitrous oxide, also known as laughing gas. Why is this a beneficial option for moms to be, other than, like you said, it's not going to be as long lasting?
Well, it's not exactly laughing gas like you'd find in a dentist's office. This is a 50% blend of nitrous oxide gas with oxygen, so it's very safe and specifically made for labor and delivery. So it's going to be a great analgesia that's going to give her some pain control during the labor and delivery process, and also help with anxiety.
All right. Let's stop right there. She's self-administering this. We're watching her put that mask on. Obviously, this isn't, there's no nitrous oxide going in, but that's what the patients are going to be able to do, is determine how much they need.
Right, and that goes along with our campaign of being a hospital of choices. It's going to be completely patient-controlled. The machine is actually initiated when she has a tight seal around her mouth and actually draws that first breath of nitrous oxide gas, so she can get as little or as much as she needs. And there's really no possibility of ever overdosing, because it's really her that has to initiate the process of the gas going in.
All right, let's compare the two. If you're comparing apples to apples here, you say it helps more with the anxiety of the pain. A lot of times when we know something's going to hurt, we tend to tense up, and we're not really allowing our bodies to do what it needs to do. A lot of times when women get the epidural, the body can go, okay, now I got the rest of this. I'm going to go ahead and dilate and get ready to have this baby. How much is she going to feel? I mean, and be honest, because just be honest.
Well, it's not going to take away a grand majority of the pain like an epidural would, but it is a great option. And as you just pointed out, it's really going to help with anxiety, where an epidural or, say, an IV narcotic really isn't going to do much for anxiety.
And what's it going to do to her cognitively? How aware is she going to be of what's going on?
Oh, other than being a little more relaxed and not having so much anxiety, she'll be very aware. Yep.
So she'll be able to understand what the doctor's saying, knowing when to push, all that. Nothing's going to be inhibited by that.
Absolutely. There'll just be a little pain relief and some anxiety relief.
All right. Well, Mom Kristen, we're excited for you. She's 28 weeks pregnant. She's having a little boy. Is this something that you think you're going to consider doing?
Yeah, actually, it's something that I'm considering now, because with the epidural that I had last time, I was numb. And so, you know, it was kind of hard for me to do stuff. And the fact that they might get more oxygen kind of interests me for sure.
Yeah, that is one option, too. The baby, one benefit, actually, is that the baby will get more oxygen. So, again, Tempe St. Luke's, one of just 2 hospitals in the Valley offering nitrous oxide. We call it laughing gas, but he said it's not what you get at the dentist. So you're not exactly, we don't want to take it too lightly. It is going to still do what Mom needs it to do. So just one more option for expectant moms here in the Valley of the Sun. Back to you guys.